my retinas. Like I can do this and then I can move them separately.
Oh my God, Qaddar, I'm so impressed.
And so by now I have done more than 15,000 hijamas.
Oh, nice.
And that's also because
Hello and Assalamu alaikum. Welcome to Physiowell podcast series. And I am Mariam Sharif. Today we have a very, very beautiful and talented girl with us. And she is a perfect depiction of beauty with brains. Her name is Dr. Qaddar Zafar. And we have a lot more to explore about her. Let's ask her. Assalamu alaikum, Qaddar. How are you?
Walaikum salam. I am amazing.
Yes,
Thank
you
you.
are.
How
Okay.
are you?
I am fine, alhamdulillah.
Alhamdulillah.
So, how's life?
It's been amazing.
That's good.
It's been like this, but I'm enjoying it.
But you are like this.
Yeah, I'm just going with the flow. I'm
Going with
loving
the flow.
it.
That's the
Yeah.
best approach.
Yeah.
Okay. So, one thing that amuses me about you is that
Yeah.
you are a physiotherapist, a beautiful one, and the
Thank
intelligent
you.
one. And then again, you are, increasing your approach through strength and conditioning.
Yeah.
And then you are experienced in dry needling as well, and
Yeah.
hijama practitioner, right?
Yeah.
So, what about hijama?
Yeah.
What inspired you to get into that?
That's my one of the favorite questions to tell people, because so many surgeons come up to me and people ask me कि आप इधर कैसे आ गई? I came into hijama because see, जब हम पढ़ रहे होते थे तो हम हमेशा देखते थे कि हर 4 symptoms के बाद लिखा हुआ है this can be the diagnosis and might not be. Yeah, this medicine or falan treatment might work for one patient and might not. And the causes are idiopathic and unknown. I remember our biology professor, Professor Dr. Imran, he used to teach us biology in FSC.
Okay.
He used to ask me कि okay Dr. Qaddar आप बताएं, we weren't even doctors by then, हम पढ़ रहे होते थे, वो कहते थे जी Dr. Qaddar आप बताएं, एक खातून है आपके पास और उनका एग काउंट ये है, स्पर्म काउंट ये है और फिर भी बच्चा नहीं हो रहा, आप क्या करेंगी? हम बहुत सोचते थे अपने दिमाग से कि सर हम टेस्टोस्टेरोन कराएंगे इंजेक्ट और ये और वो, all we could think about.
Whatever we know at
Yeah,
that time.
और वो आगे से कहते थे नहीं आप दुआ करेंगी.
Oh.
And that used to amuse me कि और वो कहते थे कि बहुत दफ़ा ऐसे सिनेरियोज होंगे कि you are giving the best treatment and it's not working for the patient.
Yes.
और I used to think a lot about it. तब मैंने सोचा कि हिजामा एक ऐसी चीज़ है जिस ज़ात ने ये बॉडी बनाई है, उसी ज़ात ने हिजामा के बारे में हमें बताया है. तो the manufacturer himself is telling about a solution 100% it's gonna work for the body.
Yeah.
Because सुन्नत में जिक्र है कि whoever gets cupping done specifically on the moon nights तो उनको मौत के अलावा तमाम बीमारियों से शिफा मिलती है. So that's how I came into this.
That's really interesting that you really thought about it
Yeah.
and then you give it a try. So, जिस तरह मौत के अलावा हर बीमारी का अल्लाह ताला की मर्जी से शिफा है.
Yeah.
तो आपने अपने एक्सपीरियंस में कितना देखा है कि how much patients get satisfied and
Yeah.
treated with that?
See, I'll be very honest about this. So by now I have done like more than 15,000 hijamas.
That's a great number.
And I'm so passionate about it. And the reason I'm passionate about it is the results that I get. They're honestly magical. They're honestly magical. I remember the first hijama that I ever did was, I'll be honest here, was just an experiment.
Okay.
I got to know, I studied कि okay अल्लाह ने बताया है यकीनन शिफा होगी. As a Muslim, I'm sold on this. Let's try it. And the time I tried it, उसके बाद जो खातून थी वो वापस आई the next month and she told me कि doctor, I did not have a panic attack for 1 month straight and I did not feel pain in the body. And I thought, one, it's placebo.
Okay.
People just don't know, they're not aware. And two, like there are variables. I cannot manage anxiety with just cupping, it's not possible. That's how I thought about it. That's what I have been thinking about it. लेकिन फिर जब मैंने करना शुरू किए ज़्यादा हिजामाज और जो मेरी केस स्टडी खुद की चल रही होती थी, I realize it's beautiful. Like as a physio, जब मैं frozen shoulder treat करने के लिए I start my treatment with the patient, it takes me like 3 months easily
Yes.
for a frozen
Depending
shoulder.
upon the condition of the
The
patient.
condition, absolutely. But I remember this one patient I met last month. I did her cupping. I, as a physio, cannot expect कि मैं हिजामा करूँगी और आपका frozen shoulder grade 2 बिल्कुल mobile हो जाए. But then
Reversing.
that happened. So it's a surprise for me every time. Then this one patient, um, she was on 2 mg for antidepressants, and now she's coming up to me डेढ़ माह बाद and she's telling me I'm on 0.25.
Oh, that's
So the
great.
results that I get for managing anxiety, body aches, for weight loss, managing your overall health is I can vouch for this.
It's so happening to know that there is something which can do wonders
Yeah.
for us.
Yeah.
Please tell me that what are the myths, common myths and misconceptions that you hear from the patients as well कि अगर हमने हिजामा कराया है तो डॉक्टर साहब
Yeah.
ये हो जाएगा और मेरा भी एक
Yeah.
पर्सनल क्वेश्चन है कि वो जो निशान पड़ते हैं वो जो कट्स
Yeah.
लगते हैं वो पेनफुल है वो किस तरह डू यू मैनेज इट
Okay, so though parts, is it painful? No, it's not. By the look of it, as scary as it looks, it's not really painful.
Yes.
ये बिल्कुल हमेशा लगता है जैसे कोई पेन से निशान लगा रहा है. तो जो पेन की नोक की चुभन है, because we cannot even call them incisions. वो इतने बारीक होते हैं और इतने छोटे होते हैं, we just call them scratches.
Okay.
और वो scratches can give you the result. So one, it's not painful. Like if I have to rate it on a scale of 10, I would say 1 out of 10. And the second one is myth. One question that I get a lot is कि डॉक्टर मैं हिजामा कराने जो आया हूँ या आई हूँ इससे अच्छा मैं ब्लड डोनेट ना कर दूँ. I would save a life and I would also get sawab. It's a win-win, and I tell them, see, the blood that you're donating is the fresh blood that you're donating.
Yes, it's
Hijama
from the
में-
veins.
Yes,
Yes.
and in hijama we're just taking the venous blood out of the body. वहाँ आप 500 से 900 donate कर सकते हैं. This is max what? 40, 50 ml. So this is nothing, and this is just the toxin that has to come out of the body. This is the fresh blood. So it's not a win-win. It's not the same situation.
Okay.
So this is the basic question that I get.
Yes, a very interesting misconception that you
Yeah.
have just answered. So, कभी ऐसा हुआ हो कि पेशेंट का आपने ट्रीटमेंट किया है एंड पेशेंट गेट्स यू नो अनकॉन्शियस इतना उसका
Yeah.
ब्लड लॉस हो गया इस तरह का कोई इंसिडेंट हुआ हो या पेशेंट डर गया हो फोबिक भी होते हैं
Okay, so first thing I need to clear, जैसे अक्सर लोग जैसे मिथ पे बात हो रही थी तो अक्सर ख़वातीन ये बहुत पूछती हैं. दो सवालात होते हैं. वन, आई गेट माई पीरियड्स, मेरा गंदा खून निकल जाता है. डू आई स्टिल हैव टू गो थ्रू हिजामा? यस, बिकॉज दैट इज जस्ट द यूट्रस वॉल कमिंग आउट ऑफ द बॉडी. हिजामा इज द डिटॉक्सिफिकेशन ऑफ द बॉडी.
ओवरऑल ब्लड.
Overall, yes. And two, people ask me कि मैं anemic हूँ and for instance my HB is 9. Can I still get hijama done? Yes, because hijama में आपका blood loss नहीं है. That has nothing to do with reducing your hemoglobin. So it's absolutely safe, and studies shows it helps with the production of red blood cells. Yeah.
Good. I have a question. Like, I have never gone through hijama.
Yeah.
And I would really love to explore this thing on myself.
Yeah.
What would be the one piece of advice that you would give me or anyone who is going to get hijama for the first time? What
Yeah.
would that advice be?
I would say one, don't be scared. It's not painful. You're
Okay.
gonna think it's painful, it's not. Two, stay hydrated.
Okay.
Because if you're hydrated, तो वो आपको help करता है with the healing and with the cleansing process and helps us get more toxin out of the body.
It has
too.
only one session or a number of sessions that we have to take?
Absolutely depends on the history of the patient, but my usual recommendation is to get at least 3 sessions.
Okay.
But then again, depending on
Each
the severity.
every month?
Medically, it's absolutely safe to get it after 15 days.
Okay.
I recommend to at least have it once a month.
Okay.
But again, depends
To
on
be
the
on the
severity.
safer side and depends on the
Absolutely.
patient. and
Yeah,
patient.
yeah,
Okay. So you are, mashallah, you graduated from Rifa?
yeah. I did.
Rifa, you did that. And after that, what came into your mind to be a social media influencer at that time? And
Yeah.
how's the journey from that time till now? And how have you been? How's the growth?
Well, I never thought I would turn into an influencer. It was never my goal. So my goal was to work and be the best in my game.
Okay.
That's all I thought about. I had no that I have to compete this or that and I have to become this. I never had, sadly, any mentors
Okay.
or any inspiration. I just wanted to be the best of what I have studied and what I have learned. I just wanted to challenge my expertise के क्या मैं ये कर सकती हूँ, क्या मैं ये ठीक कर
Just to
सकती हूँ.
explore yourself.
Yeah, and then I just had one page that I started. और उस पे सिर्फ ये था कि I'm just putting out my word out there कि okay 10 लोग देख लेंगे और maybe like 50 देख लेंगे, which is just my friends and family, उनकी help के लिए. It was never my goal to expand it to the point कि now people approach me and they see it and I have a cloud there. It's more like a cute family that I have there. So I started with my work, and it's safe to say 60% of my followers are either my patients or my colleagues or my friends.
Well, that's good to know that your colleagues are, supporting you, and patients तो बहुत sweet होते हैं. Generally speaking, मैंने भी देखे patients are really like your children.
But I would not 100% agree to that.
Okay.
Patient is sweet on your face. जैसे वो कहते हैं ना कि शागिर्द और पेशेंट किसी का सगा नहीं होता. They just want their work done.
Yeah, maybe
specifically if they have paid you and you're into healthcare, they want their work done. So you have to make sure you get their work done.
The work done, good work done.
In a good way, yeah.
So, having said that, have you ever experienced any discrimination from the patient regarding the payment? Like, they want to pay to the surgeon, they would pay to the other practitioner, but they would not pay to a physiotherapist. They would not pay to somebody who is asking them to do or have sessions for particular treatment.
I would like to answer it in two ways. Okay. One, I always say know your niche and then play with them, work for them and serve them. So I don't try to engage myself in a niche that cannot pay for the value and the quality that I provide, one. And two, yes, उसमें भी एक mindset होता है कि मैं 12 लाख के घुटने बदलवा लूँगी, but मैं 1 से 2 लाख घुटनों को दोबारा चलाने पे नहीं लगाऊंगी. So it's their loss, sadly. What I can do is counsel them and help them know कि आप घुटने बदलवा के भी दोबारा चल के भाग नहीं सकती till you get the physio done.
This is really sad because you just said this is their loss, and this is sad to understand because I think social media basically has given us the opportunity and the freedom to speak whatever we want. Because मैंने notice किया, आपने भी किया होगा कि social media की help से पहले तो physiotherapist इस तरह से social media पे open भी नहीं होते थे. मुझे लगता है हमारे time पे थोड़ा सा physiotherapist ने इसमें आना शुरू किया, and you are one of the earliest physiotherapists to be in the content creation field and influencing field. So अब ये चीज़ें patients तक पहुंचाना, अपने ही field के बारे में awareness spread करना भी I think easier हो गया है.
Absolutely.
Or it's more into our own hands, right?
Absolutely. Absolutely.
So, any tip to the growing physiotherapy influencers, or if any influencer in short, any tip to how to grow their social media and how to put on a productive and useful content into that?
I would say, one, to all the physios that are trying to grow on the social media, one, invest in your social media.
In what way?
So when I say invest in the digital marketing. Okay. Two, know your niche. Know your niche and just serve them. Saves a lot of time and effort.
Yeah.
Three, be consistent. If you're not consistent, no matter what amount you have spent on your studies, on your profession, on your digital marketing, it will go down to drain. So these are my 3 tips: that be consistent. First thing first, be there on the social media. And then you are consistent and you're knowing your niche and you're giving your best.
And do you agree? Don't copy others. Like you can take the inspiration, but don't just do the same thing which others are doing, so that एक बोरियत सी ना create हो जाए.
That's so wrong on so many levels when you're copying the person. That's just, I don't know कि इनका ज़मीर कैसे इजाज़त दे. That's just so wrong on so many levels. If you're inspired, make sure you're giving them the credit.
Yes, please do that.
Yeah.
Right.
If you're not giving them the credit. You're just a fan who's not a good fan.
Who is not ready to accept that he or she
Yeah,
is your
it's the
fan.
bad fish.
I think this comes under the umbrella of ethics of being on the social media as
Yeah.
well. Like for
Yes,
the
absolutely.
followers, there is in some ethics, and then for the other influencers, there are some ethics that we and everybody else should also follow. Right?
Absolutely.
I have noticed you. You are a funny person. Funny in
I
a
am.
way that you have a good sense of humor.
Yeah.
So, would you please let me know any incident, embarrassing, or any incident that was fun?
My sessions are usually one-on-one sessions, so they are very chatty. I make sure the person feels at home, they feel relatable, they feel comfortable, so they can share what's going in their head and generally feel light.
Yeah.
I can think of two
Please.
people. Yes, this one person that I was treating, and I was helping them with their ranges, and I remember stretching. I was giving them a piriformis stretch, and my head was just there on the level of their buttocks, and they. I remember that woman farting on my
Don't tell
face.
me.
Yeah, I could feel the. It was like,
Okay, that's
and she
fine.
was like, "Oh, I'm so sorry." It's like, "It's okay. It's natural. I don't mind."
Yeah,
Happens
this is
to everybody.
natural. Yeah, this
So
happens
this
to me.
And then I remember this one kid. It's like he was fat and short and 15. And it's like this. And it's like, "Doctor, you're a liar." और
Oh,
मैंने कहा कि
what
yeah,
did I do?
hello. And it was like, I saw your picture on Ola Doc. You were so white and cute.
Oh,
and
please,
you
don't
don't look
tell
like
me.
that. और मैंने कहा कि, oh well.
Don't tell me he came to you just because you were looking white on Ola Dog picture.
And it's like, okay, wait for your treatment, and let's hope you get the same
And let's
treatment.
talk about
And then
your
I
body
waited.
too.
And then I didn't mean to be rude. And then I waited for the treatment to end, and I asked him, did you get the professionalism and the treatment? And it was
Then-
like, yeah, I did. So it's like, that's the goal. You don't have to see if the doctor is pretty.
True. Okay, so we have a very beautiful session with you. But one thing that I want you to do for us is
Yeah.
please show us your any hidden talent. Because I know you are talented.
My hidden talent that
Yeah.
people don't really know of
Yes.
are actually two. One, I can move my eyeballs, my retinas, like I can do this, and then I can move them separately.
Oh my God, Qaddar, I'm so impressed.
And then I'm hyper flexible, so I
Okay.
would have to show
Yes, please.
it to you that I can twist my arms around.
I can't.
So
How
this
do you
is
do this?
just Allah just
You can't teach me that.
bless me with that.
Blessed you with the
Yeah,
hypermobility.
so it's the hypermobility that goes in my way. It helps me.
Is there any trick to do that?
There isn't. You can prepare the body with time. Might take you like 6 months to 1 year.
Okay, but you are flexible now. But I really like it. Qaddar, it was really, really fun talking to you.
Same
And I
here.
really loved that you came here for me.
Thank
and
you.
I really wish you all the very best for your future, with your patients and with your personal life as well.
Thank
and
you.
all the very best. Thank you so much.
Thank you. It was an honor to be here with you. And I've seen you as my senior working with me. It's been an honor to be here with you and to be able to help the physio community and share the bits of pieces we
Yes.
have to let people know the life is beautiful. As a physio, you can bloom and you're going to enjoy it.
Inshallah.
Inshallah.
Thank you so much, Qaddar.
Thank you.